Good morning, Sreekanth. How are you doing? Thanks a lot for joining us today. I'm really excited to talk to you. Before we start, can you give a quick introduction to yourself and let us know what you do at PI Health Sciences?
Hi, good morning. I'm Sreekanth Ramachandran. I'm head of discovery chemistry at PI Health Sciences. So my role at PI Health Sciences involves the scientific and strategic leadership in discovery chemistry, which includes medicinal chemistry strategy across all discovery programs. So my day-to-day operations include operational excellence, ensuring quality, compliance, reproducibility across all chemistry workflows, and stakeholder management, which also includes aligning resources, budgets, and timelines with business priorities. I also oversee the chemistry operations, including safety, hiring, skill development, and cultural building, which is aligned with the PI Health Sciences growth objectives.
Thank you, Sreekanth. So what I want to ask you to start off this fireside chat is, what are the major trends that you are observing in the medical and the synthetic chemistry, which is shaping the industry? Can you share some of your thoughts around that?
Yeah, we are working at the forefront of innovation in the integrated drug discovery services, which includes top-class solutions in synthetic and medicinal chemistry areas. We include cutting-edge technologies in synthetic chemistry, such as late-stage functionalization, photoredox chemistry, electrochemical chemistry, coupled with the traditional methodologies to access the untapped chemical space to enable the first-in-class and best-in-class medicine discovery to our clients. So you also tap into AI-driven molecular design and predictive chemistry with modern computational tools to support a design of molecules precisely targeting the mechanism of our interest. So we work closely on all modern emerging modalities such as PROTACs, molecular glues, and other targeted protein degradation mechanisms, along with peptides to drug the undruggable.
Okay, thank you, Sreekanth. That was very insightful. So I want to understand now, what are the various strategies that you apply in medical chemistry or discovery sciences? Can you give us some thoughts around that, please?
Yeah, absolutely. So we apply all sorts of different strategies in coming up with lead generation for various discovery program, which includes virtual screening, high throughput screening, and scaffold hopping approaches, starting from literature leads. So these are the variety of applications for the lead generation. And as we move from lead generation to lead optimization, so we targeted a multi-pronged approach, including traditional synthetic SAR approaches, looking at the more deep-driven SAR from the computational perspective, and target-driven approaches. So we also include the multi-parameter optimization in our approaches. So overall, we approach this holistic program to tackle these broad issues of multi-parameter optimization in drug discovery. And we have shortened the timeline to reach clinical candidates based on these approaches.
So Sreekanth, my next question to you is, what are the various modalities that you follow in the drug discovery processes that are meaningful or important or impacting for your partners? Can you elaborate a little bit on that, please?
Yeah, absolutely. We are into a great era of different modalities in drug discovery. So starting from small molecules all the way through the new modalities or the emerging modalities like the targeted protein degradation modality, which itself is so broad. We cover all sorts of TPD modalities like PROTAC, molecular glues, PRIPTACs, and any new targeted therapies coming up in the space. So we are expertise in creating those building blocks. We have a library of building blocks available to create an enormous amount of these potential modalities and tackle this problem head on. We have classical chemistry to tackle like this, and we also have library synthesis chemistry available on this particular aspect. And we also started working on this peptide, which has got renewed interest nowadays. And we are gain expertise in peptide synthesis, tackling the impurity profiling and creating and even scaling up on peptides.
Sreekanth, can you tell me what are the various strategies that you're implementing to shorten the timeline of drug discovery and also make it cost effective for your partners? Can you elaborate a little bit on that, please?
Yeah, thanks. Great question. So, we adopt multiple different strategies, and a few of them includes in the use of AI in our workflow to come up with very precise design strategy every stages of drug discovery. And we have a great supply chain to bring in cost-effective goods in a very timely manner to push the boundaries of getting these projects done in a very effective manner. Okay, so we also use computational chemistry in the workflow, and which also saves a lot of cost and time using the precise design for each project. Yeah, regarding the timeline, I would like to add that comparing to industry standards, we have a very short timeline to go for lead generation because we use the AI-driven approaches, and so basically you can get it done in like 3 months. Getting the lead generation, the profiling, and the lead generation, and moving from lead generation to lead optimization, we can get it done somewhere in there between 6 to 12 months, which is pretty fast in terms of the industry standards, because we use all these advanced digital technologies in the workflow, coupled with an extremely experienced workforce, which are very efficient in making this happen.
Sreekanth, now I'm excited to know a little bit more about the niche chemistries and the niche capabilities at PI Health Sciences. Can you elaborate a little bit more on that?
Yeah, very happy to discuss on the upcoming areas which we are focusing on to differentiate ourselves from others. So we work on the differentiated modalities like the peptides, antibody drug conjugates, oligos, carbohydrates, and of course chiral molecules, traditional small molecules. And we are equipped to do all these different modalities, and we have the infrastructure to come up with both in terms of synthesis and purification and characterization of all these modalities in a very time effective manner. So this is a great generation we are having of all these different modalities impacting drug discovery.
Sreekanth, what I want to know is, apart from discovery chemistry, what are the other collaborations that you're driving which will ensure efficiency in delivering your solutions to your partners? Can you please give us some insights around that?
Yeah, absolutely. So we start working very closely with computational chemistry, which includes modeling, and then once we start designing and synthesizing, which happens in my department, right? And then we move this molecule towards profiling. So profiling can be in the in vitro biology side, and then it can go into the in vitro ADME side. So once that in vitro profiling is done, the molecule moves further into in vivo pharmacology. And once that's been cleared, that it can have a safer path into toxicology studies, which includes all the IND enabling studies, and then move all the way to clinical candidate. So we basically collaborate with a multi-department to have the success in each program.
So thanks a lot for this time, Sreekanth. Before I let you go, can you let me know what would be your message for your potential partners who want to build a long-term relationship with PI Health Sciences?
Yeah, absolutely. PI Health Sciences is a differentiated service provider. We are a one-stop solution for integrated drug discovery. So we have a great team of drug hunters, which could take your problem from very early stage to the clinical stage and beyond. Okay, so we are a biotech for hire in this space, and that's our capability to get on to your problems in a very efficient manner, very cost effective, and in a timely manner.
Great. Thank you, Sreekanth. Thanks a lot for your time. It was really, really interesting to understand a lot of interesting stuff you're working on. And thanks a lot for your time. Thank you very much.
Okay, thank you.